you will have heard this news overnight. There's been a real dispute break out between the European Union and two pharmaceutical companies manufacturing coronavirus vaccines. Now, the EU slapped export controls on the Pfizer and AstraZeneca vaccines after the producers failed to meet supply agreements inside Europe. To discuss this and more, in particular how it might affect us here in Australia, I'm joined now from Adelaide by Professor Nikolai Petrovsky from the College of Medicine at Flinders University. Professor Petrovsky, thanks very much for coming on the show tonight. I know people have been raising this issue with me today on text message and email. It seems extraordinary that any government, let alone the EU, would deliberately slow down the rollout of vaccines. What do we know?
So, Peter, I think what we're seeing here is not actually a deliberate slowdown of the rollout of vaccines. It's actually an attempt to get hold of more vaccine doses to accelerate the rollout, because currently the EU is well behind countries such as the United Kingdom in terms of vaccinating the population. So they're looking bad, and they're trying to get hold of more vaccine doses from the companies that have contracted with them, being Pfizer and AstraZeneca. And obviously they don't want to have vaccine that's actually currently being manufactured by Pfizer inside the EU in Belgium, being shipped to the UK or to other countries before they get hold of their supply. So this is all about how do we get more vaccine, not how do we slow its rollout.
Is this going to affect in any way the vaccines we'll receive from Australia? Because obviously Pfizer is manufactured offshore, and that was approved only yesterday in Australia.
Well, indeed. What we know is it's a very competitive landscape out there for the vaccines that have already received, emergency use authorization. Everyone's clamouring to get a share of those supplies, and as we predicted many months ago, it's just not that simple for companies to produce massive quantities of these vaccines quickly. So, it may well mean that Australia's supply is delayed because of the contractual obligations of these companies to many different countries. I suspect they may have promised everyone the same supply, and now everyone's realising that that's what's happened, and so they're all clamouring to get their share.
We talked to them about the United Kingdom, how well their vaccination rates are going, up around 100,000. Why has Israel, I was looking at some graphs today, just exponential vaccination rates compared to the rest of the world, leading by sort of a factor of 10. How is it that Israel has got their vaccination rates up as high as they have?
So there's two factors at play here. One is the population of Israel is actually very small relative to countries like the United Kingdom or the US, for instance. So it's much easier if you've only got, 5 or 6 million people to vaccinate, you only need twice that many doses of vaccine. So that's certainly one thing. The other thing is Israel were very smart, and they obviously have a tight contract with Pfizer, which means that no matter what, they get their share of the vaccine early, unlike the EU, as we've seen, who's struggling because they wrote a contract quite late in the piece with Pfizer, and so to some extent they're at the back of the queue. So I think Israel's put themselves at the front of the queue by negotiating early, and also they have a smaller population, so they're able to roll the vaccine out much more quickly.
All right, well, we'll watch with interest. The rollout, as we told by the Prime Minister, will start in earnest, and of course the advertising campaign is already underway. We don't know necessarily where we'll all be in the queue unless you're vulnerable and an elderly Australian. You're at the front of the queue. The rest of us, I think we can wait. I don't think the sports guys and men and women should be at the front, as they might be arguing today, so they can all get to the Tokyo Olympics. But let's see where we go. Professor Nikolai Petrovsky, thanks for your time.